Good afternoon, everyone. Welcome to Cook County Health Department's School Health Update for the 2023-2024 school year. And that leads to our first housekeeping note. Can you please mute yourself so that everyone can enjoy the presentation? Thank you so much. My name is Kelly Jones. I am a health educator senior with Cook County Health Department, and I will be facilitating these meetings. Our meeting objective is to share updates and information and resources to help schools navigate school health issues, answer frequently asked questions, and provide CCDPH contact information and resources. If Dr. Hasbrook is on, I'd like to introduce our CCDPH Chief Operating Officer, Dr. Lamar Hasbrook, as he would like to say a few words for you. Welcome, Dr. Lamar.
Thank you, Kelly.
You have the floor.
Okay, great. So good afternoon, everyone. The school team, the school family. I'm Dr. Lamar Hasbrook, and for those of you who I haven't met, I have been on these calls before. I am the Chief Operating Officer for the Health Department, or otherwise known as the Local Health Officer, for your Department of Public Health. I have been in this role for about 15 or so months now and have a very, very long history of the last 3 decades working in public health and medicine and public health policy and all the like for many years, including running the state health department once upon a time here in Illinois. So for those of you who I haven't met, hello, and I'm very delighted to join you all today. I just want to introduce myself for those who are new, but also tell you how important this particular venue is for me as a leader and for us as a department, as we have launched what I'm calling the community agenda, which is really putting public in public health. And in a word, it really is all about engagement. It's about authentic, sustainable engagement with all of our partners, including you all who are representing the local school districts. And so we have a freshly minted strategic plan, which we will, once they're printed, with you both the link, but also a hard copy. Want to get that out to you all so you can kind of really know what our true North Star is going forward in terms of serving you in the community. I try to stress to my team that we exist but for the community. We are here to assist you in your journey in wellness, and also to thwart any threats to your health or any public health threats or urgencies or emergencies that may come up. So we are constantly retooling our team of talent. You'll hear from a number of our team members today, a number of different snippets on all variety of health-related topics for you all that we've queued up for you. We hope to have these meetings. I think the cadence is going to be either monthly or every other month. And again, you can help to inform us as to how much information you want. I also want to encourage you all to stay connected in between these meetings. And so in this case, I really mean for you to follow us on all of our social media platforms. If it's LinkedIn, if it's Facebook, if it's Twitter or now X, we are always putting up content for you to let you know, one, what we're doing on your behalf, how we're engaging with other partners, be it the academy, the universities, be it community-based organizations, faith-based organizations, et cetera, some of our happenings, some of our initiatives, grant opportunities, or stay connected with us through our social media platforms so that you can have a constant stream of information that we might have to offer. Obviously, our website is there for you. Again, we exist for you, the public, and we want to make things easy to understand, easy to navigate. We're actually going with a new vendor for our website, so you may see some changes there. It's a lot of initiatives and things on the horizon, that some of which you'll hear about today. We're undergoing a huge rebranding effort, so you hear about our new tagline, Building Healthier Communities, and our new look and feel, which we're doing in conjunction with the many community members, basically just to help folks really understand what our value is and how to utilize us better. And again, in terms of leveraging all that we're trying to do to sustain, improve your health and wellness and your opportunity for health and wellness. Also, I will say that from my standpoint, we look at you all as a great conduit for information. So sometimes you'll get stuff that says, FYI for your information, but I will say it's really FYID for your information and dissemination. So disseminate it to your other colleagues in the schools, disseminate it obviously to the students and the parents, things like that, so that we can make sure we're getting the information out there. Introducing you to me, let you know kind of what my priorities are going forward. And in a word, it really is about engagement with the community, putting the public in public health, which means everything we do should be jointly planned, jointly envisioned, jointly executed with our partnership with the community. We are trying to tool up both our talent as well as our budgets. And so we've been doing a lot of exercises around what I called right sizing, but the President Preckwinkle told me it is really upsizing because we understand that we are smaller in terms of our footprint and in terms of our funding than we need to be given our large jurisdiction and the audacious charge and mission that we have. And so some of the work that I've been doing in the first 15 months has really been trying to make sure we do the appropriate studies and assessments to see what kind of offerings we have, how we need to expand into other areas that we're currently not doing, and then how we need to upsize both our budget and the talent that we have, people, technology, working smart, and the rest. So those are some of the things that are going on. Again, you're going to hear from our teammates today. Many of our team members I want to thank in advance. All of the team members have queued up information to share with you. We try to make it bite-sized and digestible for you, but as always, feel after this, all of these are archived, as you know. And then I want to give you my personal email address and offer you an opportunity to reach out to me directly, feedback on these sessions, or if you need anything else that I can mobilize the team on your behalf. So to give that to you, and Kelly will put it in the comments somewhere, but it is lamar.hasbrook@cookcountyhealth.org. So that's my direct email address. So feel free to reach out to me. And Kelly, if we have time, I can take a couple of questions or comments from folks. Otherwise, I'll turn the agenda back over to you. I know we have a nice, robust list of things we're going to be talking about today.
We do have a robust agenda, but we have plenty of time for you. So if there are any questions for Dr. Lamar Hasbrook, feel free to put them in the chat. We'll be happy to answer those questions. If you happen to be a slow typer, as some people are, feel free to come off mute. And Dr. Lamar's email address and contact information has been added to the chat. If you're more comfortable with sending an email after this meeting, feel free to do that as well. So far, it looks like there are no more questions for Dr. Hasbrook, but we welcome your feedback, and we are so grateful that you had the time in your schedule to come to speak to the schools. We really appreciate it. And as Dr. Hasbrook stated, we appreciate the support of the schools. Thank you, Dr. Hasbrook.
Great. Thank you, everyone. Have a great meeting.
Thank you. We are going to continue our agenda, as Dr. Hasbrook stated. It is a robust agenda, but it is bite-sized portions because we want to make sure that you, our school staff, knows about all of the initiatives that we have been working so hard to do to produce for the community. So we will begin. This is our agenda. And a few announcements. Dr. Hasbrook also alluded to it as we will continue our meetings on a monthly cadence. We will make sure that, especially with respiratory health season coming, that we can get that information to you and make sure that you know all of the resources and all of the mitigations that you may need to be aware of. So reach out to us if you have any questions, and I will make sure that I get those meeting invites out when we have those scheduled. It looks like my share ended, so let's restart. Technology is no fun sometimes. Bear with me, please. All right. That was painless. So as I stated, we will be continuing our meetings on a monthly cadence. Be on the lookout for those invitations. And we may also be asking for your opinions for any subject matter that we may want to present to you. So be on the lookout for any surveys or any polls. All of our webinars are recorded and they're uploaded to our website as well as our YouTube page. Be on the lookout for the upload of today's meeting if you missed it. Please keep your line muted. We want to make sure that everyone is uninterrupted and can get all of the information. And I want to make sure I have your correct email address. Please make sure you send that to me. And or when you register, make sure that you have your correct email address, because I know people have changed a lot of professions in the last couple months, and we have incorrect information and we're getting things returned back. We want to make sure that no one misses out on this valuable information. If Dr. Joshi is on, we would like to welcome Dr. Kiran Joshi, who is our Chief Medical Officer with Cook County Health Department, who will now give a COVID-19 update. Are you on, Dr. Joshi? If Dr. Joshi has not made it on, we will make time for him later in the agenda. I'll give it another minute, and then we will go on to our next agenda item as to save time. Calling for Dr. Joshi one more time, and if not, we will just move on to our next agenda item. Just so you are aware, this also is further down in our resource slides, but we do have COVID-19 antigen tests available. We actually have a surplus. If you are interested in ordering from your school organization, you may click the link and order those antigen tests. Now, I would like to bring Sheila Giovanni, who is the Director of Vaccine Preventable Diseases for Cook County Health Department, to do her communicable disease update. Sheila, you have the floor.
Thank you, Callie, so very much. And as Callie just stated, my name is Sheila Giovanni. I am the Vaccine Preventable Disease Program Manager. Welcome back, and thank you for your ongoing dedication and partnership with the Communicable Disease Unit. Your daily efforts, we have been receiving your phone calls and your emails are greatly appreciated as you work to promote a safe and welcoming learning environment. So as we're entering this 2023 academic year, I would like to take this opportunity to provide a brief overview of the differences between reportable diseases and those that are non-reportable diseases. Next slide, please. So we're going to take a moment to delve into our items that are considered reportable and what details should be reported and when to report those. So we have our acute gastroenterolite, which is constantly considered AGE, and that's when we have acute bouts of vomiting and or diarrhea. Classified as an outbreak would be 4 or more in a classroom or 10% of a school population. We have our foodborne illnesses and our norovirus. Norovirus is the most common. It is considered very contagious. It is also those bouts of vomiting and or diarrhea. It is spread person to person. We have our contaminated surfaces and our food and water sources that we worry about. We have MRSA, which is something that is in school settings that is closely associated with schools activities such as football and wrestling. We have varicella, which we have definitely been seeing uptick. Keep a restful eye on that, and that outbreak definition would be 5 or more cases. We have our non-invasive group-based streptococcus. Last year in Illinois, we received so many cases that literally was more than 7 cases combined in regards to our non-invasive group A. So we're definitely really watching what that looks like this season. And that outbreak definition will be considered 10 epi-linked cases in a 10-day period. We have our mumps, which is 3 or more cases. Our adenoviruses, they are very rare, but that would be considered 5 or more and at least 2 hospitalizations and 2 lab confirmed cases. We have our conjunctivitis, which is very contagious, and that would be 10 or more, which classifies as an outbreak. For pertussis, that is 5 or more within a 42-day period. And we do have our final item on here, which is our hand, foot, and mouth, we receive a lot of calls and emails in regards to hand, foot, and mouth. And we do know that they often occur in daycare settings, but they can occur in school-age children, specifically pre-K and kindergarten. And that outbreak definition is 10 epilinks within a 10-day period. Next slide, please. So here are some outbreaks that schools are not required to report, and that would be our influenza, our parainfluenza, RSV, and COVID-19. Yes, I said COVID-19. So earlier this year, in January 1st to be exact, schools are no longer required to report COVID-19 outbreaks, and that is still current as of today. So although all of these illnesses are not required to be reported, we do encourage you to notify us of any unusual circumstances, if you're seeing any surges in cases, if there's any hospitalizations or death related to any of these illnesses. And we also welcome your feedback to contact us to discuss control measures if you're needing to seek additional clarification on case definitions and or when to isolate students and staff alike. Next slide, please. So the everyday invention disease prevention strategies are tried and true. And as such, it is important that we are always keeping them top of mind. And they are promote staying up to date on all routine vaccinations, reinforce proper hand hygiene and respiratory etiquette, implement policies that encourage staff and students to stay home when sick, optimize ventilation systems, and utilize proper cleaning and disinfection procedures. I did provide a link here in close that provides additional details that can help with everyday strategy prevention for the spread of infectious diseases within your school setting. Next slide, please. So here are some helpful links to add to your infectious disease prevention toolbox. It is important to know that all of these resources are valuable. The Communicable Disease Code, it addresses like all of the reportable diseases that we just spoke about, as well as we receive questions about school closures and when to exclude students and staff for communicable diseases. All of that information could be found there. We also have our COVID-19 guidance document. At the beginning of this, I saw a question in the text in regards to will it be updated? What we are working on now is our latest version available, and that was released on May 11th of 2023. IDPH has not put out any new guidelines in regards to COVID-19 as of yet. And lastly, I do want to mention ISB and our IDPH School Nurse Bootcamp webinar. It was conducted in early August, and it provides a wealth of information dedicated to school nurses. If you haven't already had an opportunity, I do highly recommend you reviewing these resources. Next slide, please. So it is important for us that you have our contact information. So if you've been with us for a while, the contact information still remains the same. But if you are new to our webinar, please note our contact information. We would love to hear from you. And thank you for being such an important part of our school communication. Our school community and upholding the mission to keep our students safe, healthy, and our parents well informed. Thank you, Kelly.
Thank you, Sheila. I see that there are some questions in the chat. If they aren't already for Sheila, or you have any questions for Sheila, feel free to put them in the chat. This is the time to send any questions in the chat for Sheila or any member of the Vaccine Preventable team. And while we're doing that, I see that Dr. Joshi is on. Thank you, Dr. Joshi. I'm glad you made it. I did not get your slides, so I don't know if you want me to stop sharing so that you can share, and you're already on top of things. Sounds good. You have the floor.
Thanks so much, Kelly, for your patience and all your support. And good afternoon, everyone. I think it's been some time since I last spoke to this group. Always look forward to it. Always a pleasure talking to such an amazing group that's focused on keeping our students safe. So I'm going to brief out today on a couple of issues. If I can advance my slides here. But just to give you the big picture, what we see happening right now in terms of respiratory viruses is that we're having increasing rates of COVID spread, influenza-like illness, as well as other respiratory viruses like RSV, as well as the common cold. And if the pattern holds, then we do expect things to sort of peak around the November timeframe. I'm going to speak to you about some additional changes that we see happening, including a new subvariant and an emerging variant. As always, I'm going to encourage everyone to get a flu shot and a COVID vaccine. Never too late to do that. We'll talk about some new vaccine options that are going to be coming on the market. Always going to encourage masking in the appropriate situations. That is to say, when you may have a concerning condition that may bring down your immunity, if you have had COVID, or if you have a loved one that's particularly vulnerable. Of course, I'm going to encourage testing. And most importantly, for schools professionals, I'm going to encourage getting air moving. I think that's a really important intervention. Things like HEPA filters, sometimes opening windows when it's appropriate, can really help control things like COVID-19, as well as potentially other respiratory viruses. I want to make a point that the Illinois Department of Public Health has developed guidance for schools around this, and you can get to that guidance through the link in these slides, and I'll make sure that that's shared and put into the chat. If you have specific questions about air purifiers, you can reach out to the Illinois Department of Public Health at the email that you see at the bottom of the screen here. Of course, stay home when you're sick, and I'll speak to it. I think Kelly had a slide about this. Where and how you can order test kits. So as I mentioned, there is a new subvariant that's out there that we want to be mindful about. It's one of the fastest growing subvariants and makes the largest proportion of COVID-19 cases right now. It's hard to imagine anything being more contagious than Omicron itself. But COVID seems to be continuing to adapt, and there is a possibility that it could be more contagious. Not more virulent, as far as we know, that it's not more likely to cause disease, so that's a good thing. And of course, we know that the current boosters and the fall booster that's going to be coming will cover all subvariants of Omicron, and specifically this XBB strain. So in order to confuse you all even more, there's in addition to all of this, a new variant of COVID-19, of SARS-CoV-2, the virus that causes COVID-19, and it's called BA2.86. It's got a lot more mutations in that spike protein. That's the protein that SARS-CoV-2 uses to get into your cells. That's a big jump in mutations, and the more mutations we see, we get more and more concerned that it could result in immune escape. That is to say, it could somehow evade your immune system and continue to infect you. So we know that it's going to infect a lot of people regardless of prior immunity, but we also know that prior infection and vaccines can help protect. The jury's out yet about how severe disease you could potentially get from this new variant, and that's just because, fortunately, it hasn't increased so much just yet. And with respect to transmissibility, as I said earlier, it's hard to imagine anything more transmissible than the Omicron variant, and there's a ceiling to that contagiousness, but nothing is ruled out just yet. So a lot to take in there. Know that CDC, the Illinois Department of Public Health, and of course CCDPH continue to monitor and conduct surveillance. And I'll speak to some of our indicators that we're looking at on a new surveillance dashboard in just a moment. I mentioned vaccines earlier. I don't want to make this presentation, I don't want to exclude influenza here. And of course, I want to encourage everyone to go out and get their flu shot. There's a new flu shot that's out there that works against, or that uses 4 strains of influenza. And some reassuring data coming out of the Southern Hemisphere that was released just today, this morning, that the vaccine reduced hospitalization risk by 52%. So that's really significant, and thought to be highly predictive of how effective this vaccine is going to be in the Northern Hemisphere. So we use data from Australia because they have their winter and our summer to understand how effective that vaccine is going to be in the United States, in Europe, and throughout the Northern Hemisphere. COVID-19, some updates on vaccine there. The vaccines are going to be commercialized, and so it's not that the federal government is going to be paying for vaccines anymore. That's going to stop, and vaccines will be available for purchase directly through manufacturers. All the 3 major manufacturers, Moderna, Pfizer, and Novavax, are planning to be in the market this.
Dr. Joshi, you muted yourself.
Thanks so much for that, Kelly. That's a much better match for current circulating strains. We are currently waiting for a CDC committee to meet. That's going to happen early next week. And there should be a lot of media coverage and news there as to who exactly they're recommending this specific formulation for. Okay. I want to make folks aware that while the vaccine is being commercialized, the federal government has been working to make free vaccines available for anybody who's uninsured and underinsured through a so-called bridge access program. So local health providers, local health centers like community health centers can work with their state and local health departments to obtain that vaccine. We are working with our community-based organization partners, as including federally qualified health centers. These are sliding scale health centers that serve folks that are uninsured and underinsured to make sure that they have adequate supplies of those vaccines. And of course, there's a retail component here as well, in which CVS and Walgreens will have vaccines made available to them. So you can go to your local CVS and Walgreens to get vaccinated regardless of insurance status. So again, really hopeful for this program. My understanding from conversations with my colleagues at the state and just reading some media coverage is that it's been delayed a little bit, but it certainly is coming. So as I mentioned earlier, we do have a lot of resources available in terms of being able to host vaccination clinics. If you're interested in that, you can put in a request. We don't list this link here, but vaccine.cookcountyil.gov is sort of a one-stop shop for that. You can also go to our website. We can provide test kits, PPE, and of course, communications materials, all available through cookcountypublichealth.org. Just wanted to quickly here, just given the number of presenters, go through some of our data. We do have a new COVID-19 data dashboard. The link for that is on the bottom of this slide, or you can go through our website. As you can see, the opening page provides an overall status as to what's happening with COVID, as well as key indicators related to community spread and really the prevalence of severe disease, because that's what we're focused on right now. We're not so much tracking individual case counts or looking at test positivity. Those were common metrics that we were using previously, but rather indicators of severe disease like emergency room visits, hospitalizations, and of course, deaths. Fortunately for us all, they all remain low right now. I do have additional slides in this deck that walk through each of those individual indicators. I'm going to defer those given time and turn it back over to Kelly, but once again, we'll make sure that these slides are made available to everyone on this call. Thank you so much to everyone for all that you do. Appreciate you. And happy to take any questions and stay on and answer questions. As per Kelly's comments, please put those in the chat and I'll stay on and try to get you answers. Thank you.
There are a couple of questions in the chat for you, Dr. Joshi, and while we go over those, I can bring up the current slide deck. Dr. Joshi, one of the questions is, so masking is not a reliable preventative measure for COVID transmission, or does the Cochrane report support this? Sorry about that.
Yeah. Oh, I love that question because I think we've got a fellow nerd that really likes to dig into the data. So there's a Cochrane. Cochrane is a group that basically takes a bunch of studies and like tries to synthesize all the data from those studies and produce something called a meta-analysis or an analysis of existing analyses. And so there was some media coverage about a particular meta-analysis that this Cochrane group conducted. And the take-home message there was a message that, in my view, got muddled. It's not so much that masks aren't effective, rather, it's that you have to be wearing a certain kind of mask in certain kinds of settings. Okay, and without getting too much into the details, I would say with confidence that if you've got a KN95 and you have a situation in which you have had COVID, you should still wear a mask because that can prevent you from infecting other people. And if you have a condition that brings your immunity down, or if you live with someone who's vulnerable, like a senior that has an immunocompromising condition, not a bad idea to wear masks. I think it's still kind of like at this point, kind of an individual decision. We're not mandating anything. I think it just makes good sense in these situations to mask up. All right. Thank you.
That's pretty
Great
interesting.
question.
Thank you. Next question. Is weekly COVID testing for COVID-19 in the school setting recommended with moderately increase in COVID-19? I think you're muted, Dr. Joshi. Did you want me to repeat the question?
Please do. Yeah, my audio went out on that.
That's
sorry.
okay. Is weekly COVID-19 testing in the school setting recommended with moderately increase in COVID-19?
Yeah, great question. I don't think we're recommending anything like weekly testing at this time. I think rates are still low while increasing, and if that changes, we'll certainly let you know.
One last question. Do you know when the federal government will stop paying for random COVID-19 testing in a school setting, if on Medicaid and or free and reduced lunch?
That's a great question. I don't know the answer to that specific question. I can say that we get our test kits through the state, and we've been told that that program will be sunsetting and ending. And so the tests that we've been getting are sort of among the last batches. I suspect it's going to be similar for schools, but I don't know specifically.
We have 3 more that just came in. Will the new COVID-19 vaccine will be free to the public?
Yes and no. It's not free if you have health insurance. And as I mentioned, it's because it's not that the federal government will be subsidizing anymore for everyone. So if you're insured, you go to your provider, they have to buy that vaccine, and in some way, they're sort of passing that charge on to you. Although I think for most folks that have insurance, their insurance will cover it. For anybody that's not insured, the options are you can go to a community health center, like a federally qualified health center. Some local health departments have vaccination programs. We have a mobile program that's going to be active through December. And then another option would potentially be through CVS and Walgreens. As I mentioned, that particular program has been delayed a little bit, more information to follow, but I'm confident it's going to be up and running based on what I've heard.
Great information. Another question, the CDC still recommends to stay at home for 5 days. Is this still recommended for students who test positive?
Yeah, yes.
And lastly, it's also related, should we be enforcing the current COVID guidelines for isolation, i.e. 5 days and fever-free for 24 hours in the school setting, or is isolation up to the individual school districts?
I think that's a recommendation from CDC, and I would, hope that in order to keep other kids in schools healthy and well, that yeah, it would be enforced.
Last one, and in the interest of time, if there are any more questions, you can just put them in the chat and we'll answer them via the chat so we can continue the meeting. What do we do when the school district decides not to follow the recommendations of CDC? Great question.
Yeah. That's certainly something that I would find concerning as a public health doctor. I think if that's happening, I would encourage the reader to reach out to the Illinois State Board of Education or potentially to their, I forget what they're called, the Association of Superintendents, the regional educational organization. Is that right?
The regional offices of education.
Regional Office of Education.
Sure.
Thanks.
Thank you, Dr. Joshi. We appreciate all the great questions. If there are any more questions for Dr. Joshi, please put them in the chat and we'll have them answered directly within the chat. In the interest of time, we are going to go on to our next presentation and welcome Kim Conrad Junius to the floor to speak about our Boost Up campaign with Cook County. Kim, you have the floor. Thank you.
Thanks so much, Kelly and Dr. Joshi. Hello and welcome back to school, everybody. It's so exciting to see 227 people on today's school health meeting call. Thanks so much for joining us. Kelly, please advance to the next slide. All right, great. Well, today I'm talking about our Boost Up Cook County campaign, which you may already have heard of. We launched back in November of last year, just before the Thanksgiving break and the winter holidays. We wanted people to boost up before gathering with their families and friends. And here you can see that this campaign, which had it had a fall winter phase and a spring phase initially, it yielded about 53 million impressions when it was in market. And so it was a very successful campaign. You can see that we targeted 30 priority communities based on the CDC Social Vulnerability Index in suburban Cook County. And here you can see a screenshot of our map, as well as some of the communication strategies that we employed, which included social media, digital ads, live radio, streaming audio, billboards, bus ads, and corporate sponsorship of large events. We also, this was a bilingual campaign. I wanted to emphasize that, English and Spanish. And we saw an increase in people who are up to date on their vaccinations from 7.5 to 11 I'm sorry, up 7.5% from 11.1 to 18.6. Obviously, we can't take all the credit for that, but it's nice to think that we made a dent in that total. Next slide, please. Okay, so we're getting ready now. You may be aware August was Immunization Awareness Month, and with that, we kicked off the next phase of our Boost Up campaign. So there's a lot going on as we head into the fall. One thing from a communication standpoint that we as health communicators want to do is normalize the COVID vaccine as a seasonal vaccine similar to the flu. So that way, when fall is coming, just like you get your flu vaccine, you get your COVID vaccine as well. Additionally, we're wanting to emphasize that routine childhood and age-specific vaccinations are a top public health priority. The reasons for this are that we're really concerned about the relatively low rates of COVID vaccination among U.S. children that have been seen. There's been a dip in vaccination rates since COVID. And part of that, of course, is because people were staying at home and didn't have the same access that they typically do, et cetera. Also, as you're well aware, with misinformation, disinformation, and the broad politicization of COVID 19 vaccination, that has had an impact, as well as new laws restricting or prohibiting COVID vaccine school mandates in 21 states. And as I said, the routine childhood vaccination rates declined. And vaccine hesitancy has been seen. Another reason, so what I want to say is our new messaging, I failed to mention, is going to expand from focusing on COVID and flu to focusing on all vaccine preventable diseases. So all recommended vaccines per the CDC. And so that will help to normalize the COVID vaccine, and getting it as a routine thing, but it will also allow us to talk about other vaccines besides COVID and flu, including RSV. I'm sure you're all aware of the talk about, the triple demic in the fall of COVID, flu, and RSV, potential, you know, three respiratory illnesses circulating at once, and that is a concern. And there's been a new vaccine approved for older adults, 65 and older, and of course, we're also recommending for infants and young children and pregnant women. Next slide. We will be also talking about all the other vaccines that are recommended, and connecting people to the CDC vaccine schedule for 0 to 6, 7 to 18, and then 19 and above, as well as pregnant women, which there is a scheduler specifically for pregnant women. So kicking off this past August 27th, this campaign, we began with the first of 4 community activations. So we've we call it plussing up existing planned community events, like the Alpha Kappa Alpha's homecoming back to school event in Country Club Hills, where we saw a wonderful turnout. You can see a picture here of a dad and his 2 kids holding their Boost Up bags. This is the new look and feel for our Boost Up campaign this fall. It's very colorful. And we also were in Robbins at the Robbins Parade last Saturday. And we're gearing up to be at the Wolf's Flea Market on September 24th in Rosemont, and then at the Blue Cap Farmers Market in Blue Island on Saturday, September 30th. You'll notice that at the last 3 bulleted events, there have been or will be immunizations for COVID offered for free, as well as $100 gift cards to those who receive the COVID vaccine. So if you or your students or friends or family would like to get vaccinated or get a boost bag, please come to these events. These boost bags contain Clorox wipes, hand sanitizer, Kleenex, and the vaccination schedules for the school-age population. I'm sorry, next slide, please, Kelly. We will be providing connections to the other vaccine schedules for adults on our boostupcookcounty.com website. And this will be a full-on mass marketing campaign that you'll be hearing more about. It's currently still under development, but creative is being built, and we're very, very excited about it. So stay tuned. And in the meantime, go to boostupcookcounty.com. I'll put it in the chat for the most up-to-date information. And our website will be getting updated information next week. Thank you so much.
Thank you, Kim, for all that great information. It's been loads of fun to go to these events and plan these events, and they're well received. I would like to welcome Hannah Kite to the stage to speak about our Here to Hear mental health campaign. You have the floor, Hannah.
Thanks, Kelly. So I'm sitting in Amy's office because I'm having some audio issues with my computer, but I'm so happy to be here. As part of the Here to Hear You campaign to raise awareness of mental health, CCDPH is hosting 2 youth summits in October. One summit will be in the south suburbs and one summit will be in the west suburbs. And the summits will include a panel discussion, breakout groups, and a resource fair. And we're inviting community partners to be part of that resource fair so that youth can connect to mental health and other resources in their community. So as soon as we have a flyer and with some of those key details to share, we'll share this with the partners on the call. And we really hope that you share this invite with middle and high school students. We're really excited to bring youth together to talk about and connect on this important topic. And we appreciate your support and sharing this opportunity with teens and young adults. Thanks so much.
Thank you so much, Hannah. If there are any questions for Kim or Hannah, please put them in the chat and we'll be sure to answer your questions. Denise couldn't be here today, but through the magic of technology, we were able to still get her presentation, and we appreciate that. If there are any questions for Denise or any requests for naloxone, please feel free to check the links in the resources that we will send out. Next up, I'd like to introduce Diamond Ross, who will speak about our lead poisoning and prevention grant program. Welcome, Diamond.
Good afternoon, everyone, and thank you, Kelly. So I'm going to talk to everyone briefly about some of the updates to our grant program. I know I've talked to this team before, but wanted to share a few updates. So one of the main things is our updated high-risk zip codes in Cook County. The state of Illinois defined zip code. The state of Illinois defines zip code areas as high risk for lead exposure based on a variety of considerations, given the age of the housing and poverty rates. So right now we have over 50 different zip codes in Cook County that are now considered high risk. We had about 12 or 13 prior to now. The next thing I want to discuss is required testing and reporting of blood lead tests. The state of Illinois requires all children 6 years of age or younger to be evaluated for lead exposure. All children must be assessed for the risk of lead exposure and tested if necessary, for enrollment in daycare, preschool, and kindergarten, as we know. All blood lead tests must be reported to IDPH's lead program, regardless of the number, regardless of the results. All reports are to be reported to the state. We know that an elevated blood lead level is that's above a 5. Blood lead testing is either tested by capillary or venous blood draw. However, only venous blood tests serve as confirmatory blood lead tests. A child who is considered to have a blood lead test, again, is that is over 5. And then lastly, I want to talk about the expansion of our Healthy Homes program. Our lead program currently inspects and repairs any lead paint hazards in the home. However, we have now expanded our program to include the whole home. We now look to fix health hazards such as mold, pest, unsafe electrical, radon, structural repairs, and any other winterization that's needed for the home. Again, our programs are completely free. All there needs to be is a child or pregnant woman in the home. And when I say child, a child under the age of 6. All in the interest of time, all of my information will be shared. All the resources for our program will be shared at the end of this presentation. Kelly will share it with you afterwards. Again, like I said, our lead program currently has expanded, but these are the main things that we do. We do a free in-home lead-based paint inspection. We do interior and exterior. We do repair all hazards found free of cost to the homeowner or renter. All assessments, any updates, any repairs are done at no cost at all to the homeowner or the renter. All of our work is done by completed by licensed contractors, and all of our improvements are to be energy efficient. Again, all of those being free as well. Lastly, we do provide families grant application assistance. We do have Spanish-speaking staff to assist families who need an additional assistance as well. How can your school help? Like I said, Kelly will share the resources at the end of this webinar. There is a flyer you can share with your school families to encourage parents to apply. You can highlight the benefits of our program in like a school newsletter or website. We really just ask and thank you for being a trusted community partner with parents and families. And any additional information is on our website here, Lead Free Cook County. Also shared it in the comments box. Here's my contact information if you need anything from me or have any questions for me. I have a few minutes to take those right now too, if you have any.
There is a question in the chat. Diamond, are school nurses supposed to be keeping track of lead tests?
School nurses are not required to keep track of that. However, if you know a child has tested and has, if you are aware, but no, not that you're supposed to keep track. I don't believe the school nurses are supposed to. But again, before starting kindergarten, all children are to be assessed and tested.
Great. If there are any other questions for Diamond, please put them in the chat and she will follow up via chat. I would like to thank Diamond for taking her time out to present and welcome Nan Nguyen, who will speak about our youth risk behavior survey. Thank you, Nan.
Good afternoon, everyone. Hopefully you're able to hear me and the internet here is going to hold up. So I'll be speaking today on the Youth Risk Behavior Survey. And this survey is off of what the national surveillance does with youth health. And so CCDPH, the Cook County Department of Public Health, has recently conducted a survey of public health schools. And this was done in 2020 and 2022. And this survey was given to school districts randomly and also to different classrooms in the schools randomly and also the students randomly as well. And the idea is that this survey is aims to be representative of suburban Cook County. I know Chicago has done a survey as well, but again, that's a separate data. So we want to find out information that is local to suburban Cook County students. And so the idea is that students are voluntarily done, and this is done anonymously to give representation to the students. Again, about 96 questions are asked related to students' health behaviors and assessing student outcomes. Topics include injuries, there's different topics include violence, tobacco and substance usage, questions related to students' diet and exercise or lack of exercise, and also pertaining to mental health as well. So we do have some data up at our website, listed here on this slide. And however, if you do want to just Google it or your search preferred search engine, just search Cook County YRBS, and that data, the link there should pop up for you as well. So, so move on to the next slide here. Again, this survey is just a system to track 9th through 12th graders. The CDC also does it at a national level. You can visit the CDC website if you wanted to know about national trends on students' health behaviors and health outcomes. But again, we are doing this to monitor students' health here at suburban Cook County. Again, the data is used to help the health department and also educators and administrators and those in education and support staff just to find out more information about their student, local information about their health and health patterns as well. And this, again, is supposed to help for initiatives, programs, and targeted intervention. And so some of the findings of this survey, again, we've done this most recently in 2020 and 2022, and this data is just coming out. And so some findings that you can see are related to their health behaviors. You know, this is an example such as students' most recent, the past 30 days, their cigarette smoking. You see that about 3.3 students in suburban Cook County are currently smoking, all the way to their marijuana use in the past 30 days. About 17.4% of students have used marijuana in the past 30 days. You can find out about their diet as well. You can see that 95.1% of high school students have not ate 3 or more servings of vegetables in the past week. Again, these are just broad information. You can find out more data on our website, but again, this data is supposed to help the health department and also people like yourselves potentially just to find information about our students here. Again, the website, this is just a snapshot of some of the visualizations we put on the website. There are about 12 different topics that we want to highlight for you. So if you visit the website, you'll see kind of this visualization layout on different health topics. So for example, if you look at tobacco usage, even though nationally tobacco usage among students are declining, but if you want to find more information about electronic vapor products, you can see that from between 2020 and 2022, they also have been increasing, but students are using it at much more rate than actually cigarette smoking. So you can see the disparities too between male and female. Females have been using vapor products at a higher rate. And also in terms of their grade, students in 12th grade are using e-vapor products at a higher percentage as well. Also, another topic we highlight there is just physical activity and screen time. You can see that, yeah, the percentage of students who haven't been physically active have also between 20 and 2023. And so 22.9% of students reported that they have been active 0 days. This is compared to 2022. So they've been actually increasing in their physical activity. And then just screen time as well. As you can see, there's some disparities. Females are on their devices more often than males. And then thinking about the grade breakdown, it's pretty much kind of even across all the grades. Our students are spending a lot more time on their screens as well. So just another piece of information you can find on our website. Moving on to suicidal ideation behaviors, I know that mental health is a hot topic today. And so we have asked some questions related to that. As you can see that there's an increase in those students who are feeling sad between 2022. So in 2020, about 32% of students reported feeling sad or hopeless, or has increased in the most recent survey, but 34% of students who have seen who have felt sad or hopeless. Again, there's some sex disparities as well. Females reporting sad or hopeless more often than males. And then also looking at those who attempted suicide. You can see a difference between the years as well, going from 6.3 to 7.4% of students who have reported that they have attempted suicide. And so you can see that there are even racial disparities as well in 2022 for the students reported. So again, you can see from just these brief topics, there are information that maybe be helpful for you as, again, educators, administrators, and those support staff as well to find out more about the students you serve. Again, if you visit our website, you can look at different other topics we put out there. We'll be putting more information onto our website as well, but then also to our Cook County Health Atlas that you can interact with. It's more of a dashboard in the Cook County Health Atlas, and it's just www.cookcountyhealthatlas.org. But again, if you want to see how suburban Cook County is measured up against nationally, you can visit the CDC's website as well to kind of go back and forth between how suburban Cook County is doing compared to national or state rates. Just over in general, I think suburban County is doing a lot better than national, so that's something that we can be proud of, but there's also work to be done. And I think the takeaway from this data is that healthy students are better learners and more likely to become healthy adults. I know it's pretty obvious for you, but again, I think that's a takeaway we have to really know, is that healthy students are better learners and more likely to become healthy adults. And so with this data, again, we can have the goal to improve students' health in the short term and also in the long term. Again, short-term objectives could be to reduce screen time, to receive mental health support, or we can have longer-term goals too, to reduce the risk of cancer, addiction, or sexually transmitted diseases. So again, feel free to visit our website to get some data. If there isn't anything that you see or there's anything confusing, you can feel free to send us a data request. The link is here, and I'll actually put it in the chat as well. So if there isn't anything that you see on our website, feel free to send a data request if you want a deeper dive on a certain topic or need help in terms of interpretation. And so with that, I'll turn it back to Kelly.
Thank you, Nan. That was really in-depth and an interesting survey. You guys took a great undertaking in bringing that to us, and we appreciate it. If there are any questions for Nan, please put them in the chat, and Nan will be happy to answer them. I will now welcome Naomi Soto, who is from the Asthma and Allergy Foundation of America, to speak about the Rescue Illinois Albuterol program. Welcome, Naomi.
Hi, thanks, Kelly. Yes, so really appreciate being here. I just wanted to do a brief plug about the Rescue Illinois Schools program, which is launching. Rescue is an asthma intervention program for schools. It's administered by AFA, the Asthma and Allergy Foundation of America, and part of the Mid-States chapter through the generous support of the Illinois Department of Human Services. So a little context about Rescue. It's about connecting school nurses, school staff to the medication, the equipment, and asthma resources to keep students in school and out of emergency rooms. 80% due to the support that we're getting this year, we're able to support across Illinois almost 80% of schools with meter dose inhalers, chambers, disposable spacers, peak flow meters, and just really other educational resources. Again, at absolute no cost. Most of these have already been purchased. And we're kind of assembling it as we go. For full details of this program, we don't have the time to kind of go over it today, but Kelly and Amy O'Rourke have been so generous in helping me get a training going next Friday. It's next Friday, September 15th at 1. I'm sure the resources will have the training link if it hasn't come your way yet. Oh, okay. And thanks. And so just to kind of go over, the program itself has free asthma emergency medication, so the albuterol equipment. You can leave that slide. That's okay. You're okay. And it's going across Illinois, including many schools in suburban Cook County. The training itself is going to be partly led by me. It's also going to be led by Respiratory Health Association, who is our training partner across Illinois. Rescued, for a little bit of context, we've been running this program for the last 12 years in Southern Illinois and in St. Louis. And so we have some context as to how to make this possible, what it takes to run the program, and are really excited to launch this statewide. And really, it's about making sure that the Public Act 100-0726, which allows school nurses and other trained personnel to administer asthma medication to anyone experiencing respiratory distress, to have the resources to have the medication accessible to do that. So the link is there for our upcoming training. It'll be a 90-minute training next Friday at 1 o'clock. There's also, if you can't make it, RHA, Respiratory Health Association, and AFA, we are conducting trainings throughout the month, really trying to get a training a week until mid-October. So that is also available, and we'll also have the training available on demand, so you can watch at a time that is convenient for you. So really excited to share some more details about this program. Really, the training will look at the protocol, the equipment that you'll be getting, how we're trying to distribute the materials as equitably as possible. So schools with larger enrollments and higher asthma risk are getting more medication and more equipment, and then the reporting requirements of the program too. So super excited to bring this to you next week. If there's any questions, I'm happy to kind of give a little bit, but I really encourage you all to attend next Friday.
Thank you, Naomi. If there are any questions for Naomi, please feel to put them in the chat and she can answer those questions. And I would like to welcome Amy O'Rourke, who will speak about the chronic disease related resources for schools while we see if there are any questions for Naomi in the chat. Thank you, Naomi.
Great.
Welcome, Amy.
Thanks so much, Kelly. You could advance to the next slide. We wanted to highlight a couple of resources and funding opportunities that we want to make sure that all schools in suburban Cook County are taking advantage of. So there is the Local Food for Schools application. It's now available. And again, this is a program that's funded through the U.S. Department of Agriculture through the Illinois State Board of Education, so that schools can purchase local, unprocessed, and minimally processed foods to serve in their meal programs. All National School Lunch Program and School Breakfast Program participants are eligible. The funds can be used anytime between August 2023, so last month, and January 2025. So please visit ISB's website. I put it on the slide here, or contact ISB staff to learn more about this really exciting opportunity to leverage dollars to purchase local foods, minimally processed or unprocessed foods to serve to your students. You could advance to the next slide. Thanks, Kelly. And then additionally, we wanted to make you aware of this a grant application that's open right now, Safe Routes to School. The 2023 application funding cycle was opened earlier last month, and it closes October 2nd, so in the near future. The Illinois Safe Routes to School program enables communities, and probably many of those on the call today have participated in a program to build safer streets and sidewalks to make it easier and safer for your students to walk and bike to school. Since 2005, this program awarded nearly $50 million to over 500 projects statewide. This year, it will support both infrastructure and non-infrastructure projects, which is really special. You can watch the Safe Routes to School grant overview presentation on the link that I provided, and there is an upcoming info session, a Q&A session with the Illinois Department of Transportation and Active Transportation Alliance on September 20th. So and I did drop the link then in this slide as well for you to register for that upcoming session. So please take advantage and learn more. And then just a brief update. A few months ago, last school year, we did have a presenter from the Illinois Public Health Institute speak to you all about some policy efforts that were underway to expand healthy school meals and ensure that all students had access to healthy school meals. So it is a policy that was a bill that was signed into law this past year, which is really exciting. So this creates an opportunity, a program that will support students, all Illinois children, having access to free, healthy school meals, regardless of their family's ability to pay. Advocacy groups, including our partners at the Illinois Public Health Institute, are actively working to secure appropriation funding from the state to fund this program. If you would like to learn more or support this effort to advocate on behalf of your schools, your students, please contact our colleague Sarah Flores at the Illinois Public Health Institute.
I believe that was your last slide. Amy, there are a few questions regarding the asthma training. I'm not sure if Naomi is still on, or did Amy want to answer the question? It is, should we encourage all nurses within our district to attend the asthma training next week, or will the district lead nurses be enough?
Amy, you're on mute, but
I turned my camera back on, but it left my mute button off. We encourage all school nurses to participate in that training, all school staff that are that you expect to be trained personnel that would be providing that albuterol to students and faculty on site. So anyone broader than school nurses that you're looking to leverage or support at the school should be trained or are expected to be trained to be able to deliver or administer that albuterol or that medication. So again, we do encourage all school nurses and all school staff that are in a position to provide that type of medication. Naomi, anything you want to add there?
yeah, absolutely. Recognize that can be a challenge for some school nurses and their schedule, and so there's definitely instances where there's a district nurse who's kind of coordinating additional support for the school nurses across their their district. So, I'm happy to kind of provide additional kind of like coordinated support per district. The other piece too is, as Amy mentioned, we really do encourage for kind of any personnel who would be appropriate. So some schools are considering security staff, coaches, sometimes like secretaries or admin, anybody who might have access that would be appropriate to just understand the full program.
Great. That is great information. One more question for Amy. So all schools will have free lunch for all. Is that what you're saying? We weren't sure if they
Yeah,
caught that.
I heard. Yeah, thanks so much, Kelly, for raising that question, and thanks, Diana, for posing it. So this was a bill that was passed into law, signed into law, that allows, it establishes a program that will ensure that all Illinois children have access to free, healthy school meals. Right now, where this bill stands is it was passed into law. Advocacy groups are working to secure funding in the state budget, secure an appropriation to fund this program. So more information to come regarding when this program will be in full effect. If you're interested in learning more, or if you're interested in supporting and advocating to the government to support appropriation, support funding this program, you can contact Illinois Public Health Institute. Thank you. And their information's on the slide.
Right. And also Rosemary wants to know, how can she get the link to for the presentation to register next week? It is in the slide, but if Naomi has an actual link that she'd like to put in the chat, feel free to do that. Otherwise, it is in the slide and you will get that with the information that we will send later on. And we'll continue to let the questions come, and then Amy or Naomi can answer those questions. But I know that we have a full meeting, and I just want to highlight a couple resources, and I'll allow people to read the rest of the slides at their leisure. But just to have our Cook County Health Department contact information if you are looking to report line lists or just have general information, and the information for our COVID-19 website, as well as our general Cook County and school specific websites are listed here. That link that Dr. Joshi showed with the links added, that you can request PPEs or rides or any other resources, that you can feel free to take this slide and share with your partners. And we have information for Denise, but in case you are interested in reaching out to Denise or want to request that naloxone, that link is there as well as will probably change and may not need that request for albuterol based on the people who participate in the program that Naomi just mentioned. But if you'd like to request the EpiPens, or currently, if you're not registered for albuterol, you can send those requests to me, kjones1@cookcountyhhs.org. And there is also a new form where you must attest to who in your organization has been trained to administer that medication, and that must accompany that request. So feel free to email me with any questions regarding those requests, and I will just let everyone else read the other resources, which has already been covered. Kim mentioned what is going on with our calendar of outreach events and information on how to request PPE, as well as information on how to request a ride to your vaccine appointment if necessary. And also the link, I believe it was asked in the chat, the link to request a school clinic for your school if you're interested. So I am going to slide through those slides really quickly and just go to our last slide, if my cursor will allow me to, and we'll listen. And just thank you all for taking the time to take out of your busy schedule. I know the beginning of the school year is extremely busy, and also it's homecoming for a lot of districts today, and there's a lot going on. And we still kept over 100 people on the call, even though the call ran a little longer than we had hoped. But we are so happy that we were able to bring you this information. We're happy to support you. You are one of our greatest partners, and we want to continue that partnership. And I want to thank everyone for Cook County Health Department that took the time out of their schedule to create slides and give this robust information for the schools. As a reminder for those who join later, please be on the lookout for invite for our upcoming meeting, which will be sometime next month. It'll be sent through Eventbrite, just as we did previously, and we look forward to seeing you next month. If you have any suggestions for any meeting items or agenda items, feel free to reach out to any of us and we'll be happy to respond. And thank you also, Naomi, for taking the time out to speak to our group. And we're looking forward to your presentation next week. Amy, did you have anything to add?
No, thank you so much, Kelly, for organizing this amazing meeting, pulling all the pieces together. And thank you again to our partners throughout the school districts. Really could not support students without your support. So thank you again for your ongoing partnership. Look forward to receiving more information about upcoming meetings soon, as Kelly shared. Thank you.
And you shall receive the recording should be uploaded sometime next week, as well as you should receive this slide deck sometime next week. Thank you all, and you have a wonderful weekend and enjoy the cool fall-like weather. Take care.
Great,
Have a
thanks.
great night.
Bye-bye.
Thank you.